up front. And who am I missing? Oh, Diane is coming. She'll be here shortly. Okay, so we're going to try to do very extreme time management because we have 5 people to talk to, and we also leave room for some conversation. I'm putting this picture up because I realized that in this session we're going to be talking about community impacts, okay, and health disparities in particular. And we're not going to be educating you about the basics of what fracking is. And I apologize for that because not everybody is up to speed on, it's a pretty complex process actually. We should say all of us are constantly learning more and more about what's involved in hydraulic fracturing and horizontal drilling for shale gas in the Marcellus Shale. The Marcellus Shale is the shale basin that underlies western Maryland, West Virginia, southwest and central Pennsylvania, and parts of New York. And we have with us today Dr. Amir Sapkota, who's going to go first and is going to speak about his role in conducting Maryland's public health study of fracking. And I hope he'll highlight the health disparities and some of the health issues that the Maryland Institute for Applied Environmental Health was able to bring out in that study. I want to specifically make sure you all appreciate that as Marylanders, we are in the only state that has ever studied the public health impacts of fracking before making a decision. And then using that information along with an economic study and an environmental study, using that information to develop best practices. Now, whether those best practices are sufficiently protective of humans, animals, the environment, open question. Personally, I don't think so. But we should nevertheless be grateful that we are sitting in a state where we've done a massive amount, 3 years worth of study. That study's been conducted primarily by the Maryland Department of the Environment with a lot of help from the Maryland Department of Natural Resources. And it was done under the advice of a commission, Maryland Marcellus Shale Advisory Commission. And Ann Bristow, who sits here, is a commissioner and is going to speak a little bit about what it's been like to be on that commission as a community advocate. But after Dr. Sapkota, I'm going to ask Dr. David Brown, who's a toxicologist, has worked a lot. Can you wave who you are? You're the other male at the table. And Dr. Brown has been involved in some very important work in southwest Pennsylvania, where fracking is pretty intense. And they started a project called the Southwest Pennsylvania Environmental Health Project because one of the big issues has been that the ways in which people are affected by the many different aspects of the process of drilling for shale gas are hard for doctors and nurses to identify. And in Pennsylvania, there were even some cases of the health department suppressing the information, so you would go and report that you thought you had a problem coming from the gas well in your neighborhood because you were experiencing health problems, and you'd report that to your public health state agency, and there would be no response. So hope that is definitely not going to happen in Maryland, and that's partly why we were so lucky to do these studies, the public health study and the best practices. So Dr. Brown will go next, and then I'm going to invite our 3 community perspectives. So I mentioned Ann Bristow from the Marcellus Shale Commission. Ann is the president of the Savage River Watershed Association, which is pristine watershed out in Garrett County and Allegheny County, part of the headwaters of the Potomac. And it's in her capacity as a watershed activist that she came to be on the commission, Maryland's Marcellus Shale Commission. Ann Naw, who sits in the center of the table, is a citizen activist in Myersville, outside of Frederick, Maryland, where I believe that's our first new compressor station has been built. Unfortunately, it was a well-fought battle. The Myersville citizens really tried to object to the building of a new compressor station. If you've looked into this field, you'll know that in order to bring gas to market, it comes out of the wells, it has to go into pipes, and then it has to be recompressed every 40 to 60 miles in order to be able to be transported. So Myersville is like, on the front lines for the first new compressor station for helping to bring this gas to market. And Ann will tell us a little bit about what that's like. It's built very close to a school, right, an elementary school. And it's a pretty sad story to hear how shoddy the work is in the fast tracking of that compressor station to get it online. And then at the end of the table is Diane Pitcock. Diane is with a group called West Virginia Host Farms. Diane lives in West Virginia where fracking is very active and has been in a rural community heavily affected by the gas drilling industry. And the community she's from took a novel approach and said, if we are going to be so heavily damaged, then we are going to open ourselves up for visitors and make sure that researchers and activists and anybody can come and see what this is like. What is this really like in a rural community to suddenly be industrialized by the gas industry? If there's anybody here who is pro-fracking or works for the gas industry, I just want to say to you that we should have a dialogue, okay? I do not want this to come across sounding like there's no demonizing of people who work in this industry, of people who need those jobs. We all use gas, right? Many of us, we go to a restaurant, our meal was cooked on a gas stove. My home is gas heated. So I don't want us to come across as sounding as if we think that the gas industry is a monster out there. I think it is an irresponsible industry that needs to be helped to be more responsible. But the individuals working in that industry are not to be despised. So we should have an open dialogue about all of that. With that, I'm going to turn it over to Amir and ask him to spend 10 minutes talking to us about the work that you've done. Can you find your slides?
Yeah, I think it's right here. All right, good morning everyone, and thank you, Rebecca. My name is Amir Sakura, and I was one of the co-authors of the Health Impact Assessment. Other co-authors include Dr. Don Milton, Dr. Sakobi Wilson, Tarka Sangramurthy, and we had an incredible student helper, Malia Boyle, who did a lot of the uplifting on this thing. So I thought I would just start my talk with just giving you a brief overview of how we went about the business of conducting the rapid health impact assessment, so to speak. And I will focus primarily on our methodology and provide in this 10 minutes or so summary. Okay. So we looked at 8 hazards, basically, air quality, production and flowback water-related issue. We looked at noise, we looked at earthquakes, public safety, occupational health, healthcare infrastructure, and cumulative exposures. And I should also mention that during that 3 year of the study, we were actually brought on year 3. So we are thankful. That was primarily effort of Dr. Cliff Mitchell and other people. So health was actually brought into this process towards the end of the game, so to speak. So we were operating on a pretty rapid, very short turnaround time period. So we didn't really have much time to go in, although we wanted to do a lot of the monitoring, particularly collect baseline, air samples and so on and so forth, we just didn't have the resources or the time, luxury of time to do that. So a lot of what we did is based on a peer review of, comprehensive review of the peer review publication and reports. And where it was applicable, we actually also analyzed the data collected by other authors. So rather than just focusing on their conclusion, taking their conclusion, we actually, if the data was available, we actually went and looked at the data ourselves. We also conducted noise monitoring in the community that is already impacted by fracking. And that work was done primarily with the help of Diane, who's sitting here. So this monitoring was conducted in West Virginia by Malia Boyle. And we decided to do the noise monitoring primarily because a lot of the data that was out there was focusing on the development phase. No one was really looking at the compressor station, for example. If you think about the process itself, it's actually the compressor station that stays with the community for decades at a time. Whereas the hazards that are associated perhaps with the initial development phase, that's a transient phases. But things such as compressor station stays with the community for 20, 30 years throughout the life of that, basically that field. So we thought that was very important. So what I'm saying, so this is an example of where we looked at the air pollution data, but that was collected by Professor Matthew McCauley at West Virginia, and this was not actually present in the peer review publication. And this was, there was a lot of data on the report, but we felt that we could summarize all of that in a more, easy to read figures. So we plot, for example, the different volatile organic compounds concentration in your these facilities. So I just want to draw your attention to a couple of very important volatile organic compounds, such as benzene. And you can see that this is on a log scale. So some of the locations have a benzene concentration around 200, 250 microgram per meter cube. Okay, benzene is a known human carcinogen. We know it causes cancer. Lots of animal studies and human studies have shown benzene to cause cancer in humans. So there's no questions about that. And just to give you a frame of reference, we conduct a lot of air monitoring in an urban environment where benzene is ubiquitous. We have done it in Baltimore. We have done a lot of monitoring in Washington, D.C. So when you go and measure benzene in Washington, D.C., inner city environments, you get concentration maybe 1 to 2 microgram per meter cube. Okay, here, the upper end of, like on the location, some of the location you are seeing, like close to 200 microgram per meter cube. Okay. This was not published in a peer-reviewed journal, but there's another study from Colorado, conducted by McKenzie and John Atkett, that have published a concentration of VOCs, and they show quite high concentration, okay? And one of the criticism of that study, if you read about, the blog, is people are trying to discredit it, saying those monitoring were conducted near highways, and of course you're going to see benzene. Well, guess what? We actually have measured benzene concentration right at the highway, and we have published these findings. And when we measure benzene concentration by 895 tunnel in Baltimore, where you have 80 to 90,000 vehicles passing per day, the concentration of benzene you see at max is maybe 10 to 12 microgram per meter cube. Okay, so it's unfounded criticism. But yet, criticism like this is used to discredit the peer review finding. But I can tell you that is unfounded because we ourselves have conducted these measurements right at the highway. And the concentration of benzene are nowhere near that. This is a noise result from West Virginia homes. And these are homes that are at increasing distance from the compressor stations. Again, this work was done with collaboration with Diane, who is sitting here, and we want to thank her for, she's been incredible support for us throughout this process. And this is not a rocket science, but what you see is as you move away from the compressor station, the noise level decreases, and the noise level is very high, particularly, if you look at less than 500 feet from those compressor stations. And this is a Maryland daytime standard of 65 decibels. Okay, so it's like particularly in the homes that are located very close to the compressor stations, you see it exceeding quite a bit. And that is a nighttime standard, for example. And of course, nighttime standards are lower. So this is an issue. Okay, and I think it's more important in the context of this EZ issue because, a lot of these people, like where this compressor station, where these wells are going to be located, do not have a political voice, so to speak. Come on, let's admit it. Even if there was, trillion whatever cubic meter of this gas sitting underneath Potomac, fracking is not going to happen there. Okay, it's a big issue, and particularly in the communities who do not have political voice. So we used a whole set of criteria to evaluate these hazards. Okay, for those eight hazards, we look at the issue of vulnerable population. We look at like the duration of exposure, how long the exposures are. We looked at the frequency of exposure. In other words, how often are people exposed? Are they exposed daily, continuously, or is the exposure more like once a week or once a month and so forth? So we ranked each of those hazards. Like we assigned a lower number if it was less important, and it got a higher score if it was like more detrimental. So for example, if you look at duration of exposure, if the exposure lasted less than 1 month, we assigned a score of 1. If it lasted long period, we assigned a score of 3. And we did this for other criteria as well, like likelihood of health effects. How likely are you going to get sick from exposure to this? And this was done based on the evidence, epidemiological evidence. And then we look at severity of health effects. Like how bad is the health effect, right? So we used all these scores. And then we combined them together, and we ranked our hazards based on these 3 criteria, 3 categories. No to low impact if the score was 6 to 9, and medium impact if the score was 10 to 14, and high impact if the hazard received score of 15 and up. And we thought that was quite stringent classification for a high, for hazard to be ranked high. So when we did this, like this is an example for air, like air, for example, received a score of 2 for vulnerability, duration of exposure was 3. It's a continuous exposure, so it received a score of 2, again, high score. Likelihood of health effects, because there's a lot of epidemiological studies over the past 50 years that has shown that exposure to some of these hazards are detrimental to human health. There's a very strong evidence. So if you sum those scores together, it got a score of 15, and by our classification system, we ranked it as high. We repeat the same process for all of the 8 hazards, and this is what we came up with. Air quality, healthcare infrastructure, occupational health, social determinants of health were all ranked high, meaning that we anticipate the population in Western Maryland to be adversely impacted. Cumulative exposure, flowback and production water related issue, and noise was ranked moderately high, and the earthquake was low. We present this summer, this report to the Department of Health and Mental Hygiene and the Maryland Department of Environment, and you can read, all of these are available, including the comments that we received. And looking at the final report that just came out, it looks like some of our points did make to the final report. Perhaps not to the extent that we would have liked, but it appears that some of it did make it to the final report. And I think that is the end of my presentation. And
I just want to quickly say, while Dr. Brown's coming up, that we really owe a huge debt of gratitude to the Maryland Institute for Applied Environmental Health, because the work they did in about 6.5 months or something was a study that could have taken 1.5 years or 2, and is very well regarded by your peers, and lots more that could have been done, but we're grateful. So,
thank you.
What's the title of the report so we know how to look it up online?
it's on marcellushealth.org. If you go to marcellushealth.org, which is the website they set up, you will find links that will take you to the public health study. And Dr. Mitchell's in the audience in the back. Dr. Mitchell from the Department of Health and Mental Hygiene was probably the most instrumental person in making sure that study took place.
Can you get me on?
Yeah. Let's see. Which ones are you?
I'm going to talk to you about public health issues. Southwest Pennsylvania Environmental Health Project is a public health project. We have the view that when people are sick, you go look at the people who are sick, and you don't do a risk assessment, although we think the risk assessments are really necessary. But when people are sick, you have to look at those people that are sick. And our project was conducted in southwest Pennsylvania. Now it's in West Virginia, Ohio, and parts of New York. And when this thing comes up,
sorry.
that's it, go back one, fine. Okay?
Is that where you want to be?
you're
And you
seeing-
just go forward with the
yeah, I can probably handle that. Okay, what I'm going to talk to you about is what you find when a group of experts, public health experts, there's 5 people on this chart. There's 15 scientists and health professionals working on this project. There's another 10 to 20 health scientists collaborating with us from universities and others around the country. We are big, and we're funded by Heinz, and our project is called that because we were trying to keep under the radar, which didn't do a very good job of. And I'm going to talk about the findings from public health and show you just a few things. First was the questions, and then what we see. This is Washington County. There's 200 people in Washington County. Each dot represents a drill site. The average person near the drill sites have between 5 and 20 wells within 2 kilometers of their houses. There's 28,000 people who are within 2 kilometers of a well site. Our mission is there, and I put the mission very, very important points. Our mission is to tell people who are sick what they can do to protect themselves. We're not doing research, we're telling people what they can do to protect themselves, and in order to do that, we have to provide accurate information. The public who are in the gas fields trust nobody. So you have to win their confidence or you're not going to get anywhere. Okay, what sort of things do they need to know? They need to know what are the warning signs of the health effects. They need to know when are they being exposed. We provide real-time water and air monitors. We have about 100 of those out in various places in the southwest Pennsylvania area and in New York. We provide devices to help them clean their houses. We provide an air model so they know when they're going to get sick. We provide management guidance, how to clean your house. They need worry and help on their worry and support. They're under enormous stresses. We try to provide them access to immediate locations that sometimes in the middle of the night their houses aren't safe to live in. Excuse me. We try to let them know what it is that makes them susceptible. Some people really should not be there. And finally, we try to give them a clear understanding of the limitation of the government in terms of protecting them, because the government doesn't have very many tools to work with. I'm going to finish with the conclusions. I'm going to start with the conclusions first. This is what we find. People are exposed to toxics through air, water, and soil. Absolutely, that discussion is over. The exposures are periodic and intense for several hours, exactly what you just saw. The average exposures are not of any value at all in figuring out what's going on. The regulatory air and water screening that's being used by EPA and by the states is absolutely not capable of determining the level of hazard. That data is all wrong. The most likely physical symptoms that we see are rash, headaches, fatigue, respiratory nosebleeds, and depression. I'll talk about a little bit more about that later. There is no biomonitor. There's nothing that can be used as a biomonitor, which is what physicians need. So what we need to do is to intervene and help people who are trying to cope, because the problem is going on right now. They have to monitor their own health and environmental status. The government will not do that for them. They need to get a sense of community trust. Their neighbor may know there's a disease, that the water is unsafe to drink, but they've signed a non-disclosure agreement so they can't tell them that their water is unsafe. That's destroyed the sense of community trust and social capital, as you might imagine. Federal, state, and local environmental agencies are not able to effectively respond. And I put this in red because I think this is absolutely the case. I don't think there's anything wrong with the government. The public health process has become rule-bound. It's restricted to standard environmental tests of water and research health protocols, which are not able to meet the goal. What do we need to look at? Well, among the things we need to look at is proximity to schools. We need to look at the social disruption. Setback distances, I can talk for a couple of hours on why that's a waste of time, but I'm not. We need to train medical providers. This next 3 things are from a very good study that says look at the pattern of health effects and try to figure out what's going on. We need to look at the non-disclosure agreements problem, and we need to recognize that we cannot solve our problem by looking at normal methodology. I want to talk to you now primarily about air. These are health data. We have a nurse practitioner who goes and talks to the people who feel that they're at risk or they're experiencing effects. she goes, she gives them a standard protocol, a standard interview, has about 150 questions on it. She does health data. So this is probably the very best data that we will see on those health effects. What we get, the first two symptoms up there, and there are 11 here, and I'm just going to run through them quickly. We can talk about it later. The first two symptoms are exactly what Rabinowitz at Yale found to be statistically significant when he looked at 475 people in Washington County, Pennsylvania. The other symptoms, the eye, nose, and throat symptoms and gastrointestinal symptoms, are nausea, vomiting, and abdominal pain, and it's an odd kind of abdominal pain, our nurse practitioner tells us. People are fatigued. They're so fatigued that they can hardly get up in the morning and take care of their children. They have cardiac symptoms. There's neurological symptoms, and one of the ones at the end of that, people, for a strange thing, have trouble recalling words. They don't know they have trouble recalling words, but when you talk to them, they can't recall words. This group of people I'm showing you are 43 out of our 97 patients that we've looked at so far. We screened out anybody who didn't have a pre-exposure, anybody who possibly could be explained in any other way. This is what we find in those 43 people, and that's the way those diseases, those effects come out. 50 to 60% of the diseases are occurring in everybody. Most people have 50 to 60% of those diseases, but that's those findings. This is not new information. This is what was in the literature already through the surveys. It's what people were reporting to us. We saw what everybody else is seeing. We have not invented anything new. When I go to our nurse practitioner, I say, tell me what is happening. She said that people have lost hope. She said they have nervous system, headaches and dizziness. They have these cardiac symptoms. They don't understand what they are. They're worried about the low birth weight and APGAR scores. They're worried about reproductive effects. But we looked at 279 people at a clinic doing an SF-36, which is a self-assessment survey. We found that 30% of them were in the clinically depressed state. This is a serious problem. What are they exposed to? There's thousands of chemicals we hear. There's 12. Those are the 12. We've looked at all the data that we can find. We've reviewed all the data we could find. In New Haven, we do the science part of this. These are the 12 compounds. I want you to look at number 6, particularly methylene chloride. We find it at every single site. We find the halogenated methane at every single site. C1 to C3, they're there everywhere. They're not always measured, but they're there when you look. So we see silica dust at schools. We see fine particle particulate at every site because of all the energy that's used. Therefore, we use the fine particle matter to do a survey. Now, why is this such a problem? This is a very busy slide. Look at the right-hand side, or this side here. There's 18 processes there. They all are involved in one well, developing one well in distribution. There's 18 processes, each one done by a separate entity that is usually a limited liability corporation. There is no way that there's any coordination down the line. The coordination has occurred at the federal level, but at the wells, there's no coordination. And if you look across the top, you'll see it's diesel fumes, frac fluids, drilling fluids, produced water, biocides, and gas volatiles of radioactivity. That's what's being released. The 3, 8, and 10 pieces are well, I asked my staff to tell me what they thought the human exposure rate was. 10 is high, 0 is none. And on the far side, which I won't talk about, is really where the human exposures are occurring from each one of these processes. How are you going to possibly regulate these guys? Okay, now, okay, I can do it. All right, if you take a monitor and measure real time, that means all the time, we use PM 2.5 because as a surrogate, this is what you see. The message here are those peaks. Those peaks are enormous. And that's probably a measurement done for a week or 2 weeks that we've done at one house. We did this at 20 houses, at 20 more times at 14 houses, and look at the last curve, the last list of numbers over there. The median number is 50. That's what the peak exposures are like. And the third line in tells you the percent of hours when those peaks are occurring. The people are getting episodic, gigantic exposures again and again and again. This is the reality of it. We should have known that. I knew it because I'm an air pollution toxicologist. If you look at night, you get higher levels than if you look at the day. We just simply modeled a compressor to show what the exposures are going to look like. Averaging the exposures doesn't give you any information. I can't say that too many times. Now, we took that data for a group of people and we said, we put a monitor, we now have 130 monitors running a month each in our area. This slide I think is really important because I stumbled on it by Ryan Rhoda said, look, if you look at the peaks, Dave, and you look at the number of symptoms, there's an increase in symptoms as peaks incur. That's really kind of scary. And that represents about 30 to 40 people. We haven't looked at all 95 people that way. We will. Okay? It's not just during the drilling. This slide on the right-hand side, that side over there is right. This shows that the exposures are occurring during the completion phase. But on the left-hand side, it shows that blowdowns and leaking from the tanks is equally a big exposure, and that will go on forever until you shut down the well. Okay? If you now remember, we got one house surrounded by people. These peaks represent a house in Washington County that is being impacted by a well site, a processing plant, and a compressor station. And you can see, and depending on which way the wind is blowing, almost every day they're getting a peak exposure. This is not trivial. Okay, so I'm going to finish in a minute. So what are we trying to do at Southwest Pennsylvania? We're trying to establish a clinical resource network to support these people. People who are sick need to be supported. They don't need to be studied. They need to be supported. Then we're trying to establish a technical resource networks that can bring all the science together and do something with that. We're big. We have many projects going on, and that's just to show you that we have a lot of collaborators, a lot of projects going on. We can talk about them at some point. There's a conclusion slide again. The first three are still true. It's toxics in air and water. The exposures are periodic and intense. The regulatory system we're using will not detect them. And the last in red is the public health process is rule bound. What do you do in that situation? You tell people what to do. You give them advice. You give them information. And so basically what Southwest Pennsylvania does is gives people information. We give them monitors to monitor their health. When they're sick, we tell them where to go get treated. We try to do that. We do not study them. And that's all I have to say.
I'm going to ask Ann to go next.
Excuse me, are the PowerPoints going to be available?
I think so. Do you know that? Are the PowerPoints made available?
Yes, I'll give mine to you.
We'd be glad, I think most everybody would be glad to share.
That's up to you, and actually, I can talk about those. That's the last
Yeah.
one.
There's a lot of stuff. It's a lot to digest.
Hi there, and I don't have any PowerPoint.
Do you want the picture of the fracking process back there?
Wouldn't
when
hurt.
you're talking?
Yeah.
That might
Some-
just
something to
ground
stimulate,
people.
yeah.
Yeah, I think it's useful because we're not all always remembering everything. And Dr. Brown made the point that it's a very complex process.
And it's actually hard to figure out where to start and what to talk about because there's so much going on with this issue. Maryland is in a interesting position right now to have watched what's going on in Pennsylvania and West Virginia. I went down to West Virginia Host Farms as part of the commission when we were there over the summer. And to see what's occurring in other areas, to read the research about health effects, and then to sit on a commission studying this, to have the opportunity to hear studies, risk assessment studies. And I've only been on the commission for a year. I replaced another member of the Savage River Watershed Association who was on the commission. Came at this with an interest in water quality monitoring. I've been a member of the Marcellus Monitoring Coalition, which is run by DNR. We've been monitoring for 3 years, every week. For the first 2 years, every other week, going out to 64 different stream reaches in Garrett County. 13 of them in the watershed that I'm involved with, in the eastern part of Garrett County, which flows to the bay. The other sites are in the Youghiogheny watershed, which flows to the Ohio. So we're in two different, ends up being different jurisdictions in terms of funding issues, gets very complicated. Nonetheless, we're, I think, probably the most robust water quality monitoring program in the United States prior to Marcellus shale drilling. So we have 3 years of data. That project is slated to end in March. We have no idea what will happen with the new administration in terms of an emphasis on that. So that's how I came to the commission, was out of concern about water quality issues and feeling somewhat well educated on those issues. I hit the commission, started reading health data because it was about the time that you all were engaging in the early stages of your research, went to the first stakeholder meetings, and lo and behold, to my discovery, air is the big issue. So I want to follow on that, and I really want to emphasize that in what I talk about. I want to say a little bit about what Garrett County is like and what we're going to be facing in terms of health disparity issues. But I think the biggest concern for all of us is to figure out a way to begin monitoring with air. I've been talking with Ann about that. If we don't have some good baseline air monitoring as well as water quality monitoring, we are not going to be able to establish causality. We're not going to be able to help people receive compensation, be able to attribute causality in any legal claims that they might have. So we're in the fortunate position to be able to do some research right now because it's not here upon us. And I think that's the most critical area for us to do it. So I'm going to jump into that. If I have time, I'm going to describe Garrett County. If you have not had the opportunity to hear about this book, The Real Cost of Fracking, it's by a veterinarian, Michelle Bamberger, who's out of Ithaca, New York, and her husband, who's a molecular medicine specialist. She has done 4 years worth of interviews, mostly in the state of Pennsylvania, as a veterinarian. She has looked at herd health, other companion and agricultural-based animals. And she is now defining, in the process of doing this, she talked with the farmers who are also having similar effects as their animals. And it's the same stuff that David's finding in Pennsylvania. It's the same stuff being found in Pennsylvania, in West Virginia. And she's now given this a name, and I want to talk about what it's like in the early stages of medicine grasping something that's new, that has not been defined yet. And Michelle Bamberger is calling this shale gas syndrome to describe this cluster of symptoms. The earliest, what you have happen in medicine earliest are case studies. And this book, the first compilation that I know of case studies, and it's both humans and veterinarian health, in terms of the cluster of symptoms that are seen that are now identified as a syndrome. Once you have these case studies and you've got some consensus with what is being seen clinically, you can try to address treatment issues, and you can try to address how we might prevent these. The biggest concern that she has had with trying to document what has happened to some of these farm animals and what is happening to humans is the lack of baseline. And when they see these, the health problems in both animals and in humans, there is no way that people can establish that there weren't conditions existing in their environment that could have caused this independent of shale gas development. Absolutely no way. The best that folks have been able to do is some out-of-court settlements. There are a couple of farmers that she documents who did some extensive water quality testing prior to, and currently those cases are in litigation. I want you to know that the water quality test to try to establish baseline, so I'm looking at Western Maryland now, and a third of the income in Western Maryland is agriculturally based. Another third is tourism. So you've got people living on farms. A lot of the people who've been able to lease acreage in Western Maryland are farmers, because you have to have a 640-acre tract, so farmers are going together to establish these big tracts. To do the suite of chemicals for baseline testing, given that we don't know what is in the fracking fluid and in the flowback fluids, and also how these chemicals can combine and produce new chemicals. you have to do a kind of what we call a shotgun approach to measurement. In excess of $1,000 for water quality monitoring, to get that out of your family well, let's say, or where your livestock are drinking. Air is a whole nother ballgame, and that really concerns me, of what we can have that citizens will be able to take some baseline measurements so that if their air quality is affected, they would be able to demonstrate that the changes are due to this development coming into to their farm or to their home. I want to jump and talk about the final report that the Marcellus Shale Safe Drilling Initiative has done, which was just released on November 25th. And I want to talk to you about how air is treated in here, because I think if there's one thing that upsets me about this report, it is that area. I know that I have been talking about air since I've been on the commission. We know that the Maryland study had air at the top of their list. So recommendations that should have changed in this, based on the health study having been completed. Also, air was pretty high up on the list in the risk assessment that the state of Maryland did. The kind of changes that occurred in best practices did not address air in here. And we get two sentences at the end that isn't even a full sentence. So it wasn't even proofread well. Additional studies on the health risks of persons living near unconventional gas wells are necessary. Anecdotal reports of acute health effects due to periodic spikes in ambient air pollution levels and measurements of the frequency and magnitude of such spikes is lacking. That's all I got out of this. This is all we're having recommended. The best practices in Maryland, if they're going to be a gold standard for the nation, need to have some specific recommendations for how episodic air quality contamination events could be measured by citizens in a cost-effective way. There is a very interesting study I wanted to share with Ann out of Albany. 2 minutes, I can tell you about this. This is a consulting firm called Global Community Monitoring that trains residents to do air quality monitoring. And I was glad to hear in the session before this that it looks like there are going to be some more inexpensive air monitors out there. The other thing that this final report fails to do is to say how, or to make recommendations of how the community could be further involved to help do some of this monitoring. There is a recommended best practice of a comprehensive gas development plan that does have community stakeholder engagement. And that would be the opportunity. We don't know if that will, if those regulations will be promulgated, but that would be a good opportunity for citizens to be involved. And just what I have 1 minute to talk about disparities. The huge issue in the areas of Garrett and Allegheny counties that are underlain by shale is it's Appalachia. And one of the cultural tags with that has a lot of accuracy is that people do not want to be told what to do with their land. And there's a real issue with not perceiving that what you do on your land when you bring in an industrial gas development process could affect your neighbors negatively. And I think that's where we on the ground are going to have to do a lot of education of what you might do on your farm is going to have significant impacts on people around you, because this does not stay in the borders of your property, particularly with air, but also in terms of hydrogeologic factors. We're in a fractured rock section of, very mountainous area, and water is traveling in fractures in ways that have never been studied in that part of the state. It's a very impoverished region. There are a lot of people who are looking at this as an opportunity to make money. So we already are seeing some community divisiveness of those who have who perceive that they can make a lot of money. This would be some farmers, and then people who maybe bought 1 acre, 5 acres from this farmer and are living on the edge of their property and are going to be affected by that process and will have no opportunities to make all of this money off of it. And I'm out of time and being signaled. Be happy to share more later. There's too much of this to talk about.
we're switching slides, you know, I've gone to a lot of the commission meetings myself, and I've watched Ann Bristow in action, and she's a volunteer, and she had to learn, I mean, you should see the volume of material that the commissioners are asked to read, and short notice in order to get up to speed on these issues. It's incredible. Do you know how to put yours up? Is it that way? Quickly. There you go.
Thank you very much. Hi, everyone. Thank you for giving me this opportunity to speak with you. I have to tell you, I'm really nervous to be with this very illustrious panel here, so please bear with me. When we talk about fracking, oftentimes the industry likes to limit the discussion to the actual process of injecting liquid at high pressure into rock formations to extract gas. However, there is a very broad network of infrastructure that is required to support that process, including storage caverns, compressor stations, metering stations, gathering lines, intrastate pipelines, and interstate pipelines. And the regulatory oversight of those components falls to various local and federal authorities, if it's regulated at all. Very generally speaking, activities related to drilling fall under state statutes, while the federal government has oversight over the interstate pipelines and related facilities. And what that has meant for me, and what that has meant for the town of Myersville, is that while there is currently no fracking in Maryland, the natural gas boom has already negatively affected my town. Let me tell you a little bit about Myersville. We are a community of approximately 1,600 people, nestled in the Middletown Valley in Frederick County, Maryland. We celebrate the opening day of Little League with a parade down Main Street. Our volunteer fire department delights the elementary school children by spraying them off with the hoses at the end of the year field day. And they toss candy from the fire trucks during our annual Christmas parade. It is a place where families have lived for generations, and newcomers have come seeking the serenity and closeness that a small town offers. And it is here, approximately 1 mile from our elementary school, closer still to our town hall, and within 2 miles of our entire town, that Dominion Transmission, a subsidiary of Virginia-based Dominion Power, sought to build and operate a 16,000 horsepower natural gas compressor station to move gas along its interstate pipeline. Annually, the compressor station would release 23.5 tons of nitrogen oxide, in addition to particulate matter, volatile organic compounds, carbon monoxide, and greenhouse gases. And that is, of course, assuming that the compressor station is operating the way it's supposed to. We know that nitrogen oxide causes respiratory problems, heart conditions, lung damage. Volatile organic compounds are carcinogenic and toxic substances. The panelists here have discussed a lot of those health issues, so I won't get into all of that. But all of these will be within 1 mile of our elementary school children. And this is in a state that has the highest level of premature deaths related to air pollution, and in a county that receives an F from the American Lung Association for ozone pollution. The citizens of Myersville were overwhelmingly opposed to this plan. The so-called scoping meeting, where the plan to construct the station was presented, drew a standing room only crowd. We held raffles. We held rallies, wrote 900 opposition letters. We hired an attorney. We formed a community group. DTI countered that they wanted to be good neighbors, and they offered to make the structure look like a barn, or to make sure that we understood, more rural. DTI also stated that the station would be appropriately placed in the industrial section of Myersville. You know, because the heavy industry in Myersville consists of a gas station, a Caterpillar dealership, and the municipal wastewater treatment plant. In August of 2012, the Town Council unanimously voted against Dominion's application to amend our town master plan, finding, among other things, that the project posed a significant risk to the citizens. And in doing so, it denied Dominion the necessary local zoning required by the Maryland Department of the Environment to issue an air permit. But despite this, in December of 2012, the Federal Energy Regulatory Commission, or FERC, authorized the project. Armed with that certificate, DTI sued both the town of Myersville and Maryland Department of the Environment, using the power of federal preemption granted in the Natural Gas Act to override local and state zoning. So what is FERC? They're an independent regulatory agency within the Department of Energy with jurisdiction over interstate gas sales, natural gas pricing, oil pipeline rates. They review and authorize liquefied natural gas terminals, interstate natural gas pipelines, and hydropower projects. The President and Congress do not have oversight. The decisions are reviewable only by the federal courts. The commission itself is composed of 5 members who are appointed by the President of the United States. No more than 3 commissioners may be from any one political party. However, the agency has proven susceptible to lobbying and political influence and has long been seen as a revolving door with many former employees now employed by the gas industry. The commission also recovers the full cost of its operations through annual charges and filing fees assessed on the very industry that it regulates. When assessing a natural gas project, FERC states the review is primarily an economic test, their words, and that once the economic test is satisfied, they then review the projects under the National Environmental Protection Act, or NEPA. But here, what FERC states is that as long as the impacts to the environment, including the human environment, in other words, people, in other words, me, in other words, my children, as long as that is mitigated, the project may go forward. So for instance, there are some pollution controls, there's a vapor wall, there's a sound wall. Okay, but none of that is very reassuring to those of us that live next to those facilities. And many communities, after investing time and money and energy in the process, find it to be little more than a rubber stamp for the industry. In fact, in a recent case before the Second Circuit Court of Appeals, the FERC attorney stated that the commission, this is a quote, assumes that applications submitted by project sponsors are going to be created in a way that are designed to obtain commission approval because the sponsors invest substantial sums in putting applications together. Moreover, FERC actually holds conferences with the industry to teach it how to navigate the system. Impacted communities, on the other hand, get a pamphlet. And today, in spite of our best efforts, as you enter Myersville, you are greeted by Dominion's toxic emission spewing compressor station. But unfortunately, that is not the end of the story, because less than 2 weeks after the compressor station was placed in service, DTI has announced its plans to seek FERC approval to double its capacity. And while Myersville is one of the first communities in Maryland impacted by build-out from fracking, I can assure you it will not be the last. Already our friends at Cove Point are battling an LNG export terminal. Our friends in Howard County are facing an increased compression capabilities at one of their compressor stations. And in fact, the industry has said that every year they are going to need 850 miles per year in new gas transmission lines, 800 miles of new laterals per year, 1,400 miles of new gas gathering lines per year in order to support gas drilling. And to put that all in a bit of perspective, here's a 2008 map of the natural gas pipelines and compressor stations. So when we discuss fracking, we need to consider all the impacts associated with it, from drilling rigs to compressor stations to pipelines, processing plants, storage facilities, export plants. We must not allow separate regulatory criteria to divide and conquer us. Because what happens to our neighbors in West Virginia, in Pennsylvania, in New York, in Ohio, in Western Maryland, in Myersville, in Howard County, in Lusby, affects each and every one of us. Thank you.
So if that didn't like give you chills, Diane Pitcock will. I already have chills. Diane, do you want your picture showing, or you?
Yes,
how are you?
I think, yeah, if you could set this up to,
Do that?
I'll start up here, but I set that up just to go through like a slideshow and just let it run, because I'm going to ask everybody to multitask and see the visual images of fracking in West Virginia. The presentation that Rebecca's loading is one that we normally give when we do community workshops and such, but it obviously is a, something that would take about an hour or so to go through. So I'm going to give you the 10-minute crash of looking at it while I talk to you about our program at West Virginia Host Farms. And again, my name is Diane Pitcock. First, I'd like to emphasize that even though the draft that was recently released on November 25th of the Maryland Shales Safe Drilling Initiative, I think it's excellent because I'm in West Virginia and we don't have anything anywhere near what is in that document. So
Diane,
it's a
I just
great
want to let you
start.
know, this won't automatically slide through
Okay.
unless I change the setting.
Okay, yeah, okay, if we want to set it so it
Do you
just
want me
starts
to
rolling.
try to do that? Okay,
Yeah,
sorry.
because otherwise I can just sit there and you're gonna move it on. But just put up slideshow from beginning.
But it won't
It won't
go
do it?
through automatically. You'll have to press it.
Oh, okay,
Is that
that's okay. I can
Do you
do
know how
that.
to do that? I can press.
Yeah, just give it, just, again, normally I would be talking about what you're seeing on screen, but I just really want you to see the images while I tell you about the Host Farms Initiative. And I'm really pleased that I could be here and see some of the people that I've worked with and met or given tours for before. I am from Maryland and actually have only been in West Virginia for 9 years. And I was in Baltimore County, Harford County, and I know that Maryland is a very environmentally conscious state, certainly compared to some of the other states that are facing fracking and drilling issues. That being said, we moved to West Virginia hoping to retire, and we knew about conventional wells. They're shallow, go down about 2,000 feet, and we actually get free gas on our property because we have a natural gas well that is deeded free gas because previous owners leased the mineral rights to oil and gas companies 50, 100 years ago, what have you. And as a result, Maryland is, I don't think, quite as much of a split estate situation, but that means that one person owns the surface and another person owns the minerals below. And mineral rights trump surface rights, so they have a right to their minerals. But the problem with that is the conventional drilling only had maybe a quarter-acre, half-acre final footprint of the actual well with the condensate tank. A Marcellus gas well can take up to 8 or 10 acres of a surface owner's land, and they have no say or no choice because they are secondary to mineral rights ownership. So as a result, when we moved here, and we are surface owners, but thankfully I think they'll go under us, not drill a well pad on us, but our neighbor leased his minerals a couple of years ago for Marcellus drilling. We didn't even know what it was when we moved there in 2005 because it was just starting to come into the forefront as a new method of drilling. When they say it's still the same fracking that's been done for 60 years, do not believe that. It is still fracking, the idea of injecting high-pressure fluid and chemicals, but there are major, major differences between the two. And hopefully some of the pictures, and this slide presentation, as I said, is usually what we give when we speak at engagements, but I understand they're going to have an information table set up at 4 o'clock, so I'll have the laptop there, and I have a display board and loads of pictures, but I mainly wanted you to see the images for now. I started the West Virginia Host Farms program as a volunteer-based grassroots initiative where at the time, like, we're all volunteers. The idea that my neighbor leased his minerals and they were putting one of these enormous well pads butted up against our property. Not on my property, on his right to use his property, But what one person does on their property should not impact another person or their property or an entire community. And that's what Marcellus shale fracking does. That being said, when I realized that they were going to have 2 or 3 well pads on his separate parcels, he owned several hundred acres, they were going to have 27 horizontal legs. And that's the difference with Marcellus. They go down about 2,000 or 8,000 feet, 7,000 to 8,000 feet, and then go out horizontally, sometimes up to a mile. So somebody's water could get contaminated a mile away that is nowhere near the well pad. So this is a big issue, and as previous speakers had mentioned, that there's not enough research. They blew through Pennsylvania before anybody had a chance to do baseline water testing or air quality or to really get a grip on things and to come up with some good policies or zoning restrictions or what. So now they've headed into West Virginia about 5 years ago, and especially Wetzel County was hit hard. So as a result, you know, the need for more research is just so evident. So my role in this, as just a landowner, a surface owner, I left Maryland to retire and disappear in the hollow. I envisioned my retirement to be learning how to can the vegetables I grow, or watching the chickens peck the yard is the most highlight of my day. And now I've started this Host Farms. That's my place right there, and there's a rig up there that was the rig that had an explosion that killed 2 workers. I filmed it from my front porch. I mean, I could tell you so much. I could go on forever about the different issues. But basically what we do with West Virginia Host Farms is, my idea was that because fracking is not going to go away, I mean, this is our nation's energy policy. And believe me, I don't think for 1 minute it's about energy independence as much as it is the corporate initiative to export it all, and for huge corporate profits, because we're not seeing that it's benefiting locally. A lot of transient workforce comes and follows the industry from state to state, but economically in West Virginia, that's what their big support argument is, that it actually is good for the economy and all. These are transient workers for the most part. But that being said, knowing that we needed more research, I thought the one power that landowners, particularly surface owners who are being drilled on, that don't have a say, the one power we have is the power to invite who we want on our private properties. So when I came up with Host Farms, I started attending community meetings about fracking and speaking with other concerned citizens that had well pads coming or already there and their own issues. And I said, let's network and build a network of landowners who will give researchers access to our private properties where they need to be. Because the industry isn't going to say, come on the well pad, set up your air quality, do your test, take water samples and all. But I'm a landowner and they can test my stream, which is right below the well pad or my house. And so as a result, we've had some pretty good response. And the Maryland Shale Advisory Commission, of course, came for a tour in June, and Ann was there with them, and she got to see how the flaggers and how they treat the citizens going down rural roads, dodging potholes and what have you. But basically, and then Amir came in November the year before, November 2013, with the team from University of Maryland, and they did the noise study in a community where the noise level, when we monitor, is like 75 decibels on somebody's front lawn, which is 20 decibels above the 55 or so that FERC allows. But that's the issue. In this scenario with Marcellus Shale, it's been left to the states to regulate. And hopefully Maryland will be very responsible with it. In West Virginia, it's a culture of oil and gas drilling. That's a big part of the culture and economy in West Virginia. Thus, I always say the playing field has changed now that we're doing shale gas drilling, but the rules haven't changed. And people are being harmed terribly in West Virginia between losing their quality of life. We advocate for landowners as well as give opportunities for researchers to have access. I know a whole community where 95% of them have respiratory issues. A 2-month-old baby has asthma. These people are living right there by this compressor station, and Amir was there, and Ann was there. I mean, they saw what we're talking about. And the Southwest Environmental Health Project has come down and given air quality monitors. So this is all about networking and getting the research that wasn't there before this boom came. Pennsylvania really didn't have time to get baselines in place when they blew through there in Hickory, Pennsylvania. You know, Marcellus Shale was one of the first Marcellus wells drilled. And also, you know, the issues that they've had with the air quality and water quality. Michelle Bamberger, I think Ann mentioned Michelle Bamberger. She called us at West Virginia Host Farms, And she wants to do a cattle study where they want to hang air quality monitors on cattle. And I don't know if I have any of these pictures up here, but we have cows that are grazing right next to venting gas wells and all. And these are part of your meat supply. You know, Food and Water Watch has a lot about that. So as a result, we said we'd find her some farmers that are within 5 miles of this huge compressor site. But unfortunately, most of them don't want to participate because either people are scared because the strong influence of the industry, or they've leased, or they just don't believe that this is going to be so much more of an economic and health or environmental and health impact than what they've seen in all these other booms before. But it's unconventional drilling. It's not the same exact technique, a lot of different chemicals. So just to tell you real quick, and again, I'm going to have some handouts that I could, did I lay them over there or bring them up to start passing out? Or, oh, here they are. I'm going to, these are just some of the things I was going to have on the display table, but I understand it's not going to be set up till. So if you just want to just start batches of them around and, or just pass them through. So that'll give you some information, but please stop by if you're still around at 4 o'clock. I understand they're going to set up a display table. We've had Carnegie Mellon. I received a call from Albert Presto, who is at Carnegie Mellon, who's working with a $1 million grant to do air quality issues. And we took them around, the same area where you saw the compressor at Central Station and that well pad there, went up and did their air quality. They have a mobile unit. Duke University has been doing water studies, partnered with us for about 2 years now, where I had contacted Abner Vengosh and I said, do you want baselines that you couldn't get in Pennsylvania? I said, we'll give them to you. Contact West Virginia host farms. Our landowners that are about to be drilled on will let you come and do all the testing you want on their property. So we're not scientists, but what we do is give access. And that's what's so important, because the researchers are coming. I have volunteers that'll even put them up for the night, cook dinner for them. You know, they bring as many people as they need. We have environmental groups come, and we also have, as I said, journalists cover the stories of some of these impacts of these landowners. There's a lot of issues going on. The pipeline, somebody mentioned about, I think, every 40 miles for the big 42-inch pipelines, they'll need a compressor. In West Virginia, because all these wells have to go to the first initial place, we get compressors every 7 miles, smaller scale. But in West Virginia, they don't aggregate the air emissions. So it's all not being aggregated from a bunch of surrounding wells and a compressor. And we don't know what these people are breathing as far as what levels are harmful. So I need to stop, but I do ask you to come by the table, because I wish that I could just go on with, I have hundreds of pictures. Some of them are on the display board, and you'll get a real feel for what it's like in West Virginia, because people just have no clue that it's going to be a lot worse than the conventional drilling. So, okay? And I'll say one more. If any of you are associated with a group where you want a tour, give me a call. We just give free tours because we want the rest of the world to see what's happening.
What is your contact information?
I have cards up here that will have contact information in the website. The website's always at work, there's more stuff added all the time, but there's lots of links on there that you can see. So yeah, if you want to stop and pick up a card, you know how to get hold of us.
So we have about 10 minutes available to us for questions and discussion. Please come up to the mic and pose your questions. Try to be brief so that more people can.
Thanks to everybody. Thanks for all of the work you're doing on this. Hopefully we can keep fracking from happening. But I wanted to first ask a question, which I'll explain the relevance in a second. How many of you in the room are at least 30 years old? So I can ask the question, where were you on this day in 1984? Because that was when there was a release of methylisocyanate, a pesticide, in Bhopal, India. There's also a sister plant of the same design, or there was, in West Virginia. And what thousands of people died on that day, and thousands more were permanently disabled as a result of that. The issue it raised, and it's an issue involved in fracking here, is the right to know. This led to a whole bunch of community and workplace right to know laws that have given us the right to know, maybe not the right to act, but at least we have some idea of what the hell we're exposed to in our workplaces, in our homes. And right now, as all of you probably know, the industry is hiding behind whatever trade secret or other laws they've devised to prevent us to know from what carcinogens, neurotoxins, and on down the line are being pumped into the groundwater. And what could go wrong? So if anybody would want to care to comment on using sort of the kind of right-to-know tactic as a way to attack fracking as a whole, I'd appreciate that.
Does anyone want to comment? One thing I can say is that one of the big issues for the Maryland legislature will be a proposal to not have any trade secrets in Maryland. We don't know if we'll succeed in proposing that, but the public health community feels very strongly that there should be no gag orders on medical providers and public health researchers. And the chemical formulas that the companies are using are not more valuable than people's health, to put it in a simple word.
One of the things I'd comment about that, and you'll have the information by now if all the handouts that I had were circulated, is that the industry is exempt from 7 key pieces of environmental legislation on a federal level. And I always use this handout, it's on the way if you haven't gotten it circulated yet, Loopholes for Polluters, which is by Oil and Gas Accountability Project. And it talks about what they call the Halliburton loophole, that they don't have to disclose chemicals. And we have communities where we're forcing that we can get copies of the MSDS to see, the material data sheets, to see what chemicals are being used. Even then, when you look at those totals and you add up the percentages that are listed, it never comes to 100%. There's always a lot missing. But it's getting better that they're being forced to disclose a little bit more. And as somebody mentioned about like Duke knowing what to test for, and other places, and they test for a much broader range. The industry in West Virginia is only required by the DEP to test for 5 or 6 things, and I can assure you they're not what they're injecting in the ground. So it's a real issue.
They're actually not required to know.
Oh, they don't have to know?
They don't have to know. Because the flowback water, they don't have to test. And
We have boys in West Virginia driving trucks that have no clue what chemicals they're holding. And if there's a spill, the fire departments don't know how to deal with it.
Look, your slide, perfect timing.
Oh,
7 key federal
Yeah, that's why I
rules.
say I hope the
Yeah.
handouts help.
Yeah.
Hi, Insay Witherspoon with the Children's Environmental Health Network. Also a mom, a Maryland resident, an appalled citizen. These issues just have been so frustrating for all of us. I just want to thank you guys for all that you continue to do. I spoke with Dr. Barb Sattler. Some of you may know her. She led the Community Health Department at University of Maryland for many, many years, Baltimore campus. We did a big keynote presentation in San Antonio, Texas this summer at the National Association of School Nurses Conference. We were in Texas. We did a huge tour of, unfortunately, the decade ahead of work that's been going on there. So all that you all are showing us, the visuals, are already happening, have been happening. So prairie lands that are now deserts, 1 to 2 cows that look very sick that should be hundreds, hardly any people, kids out, and on and on. I mean, it's awful, it's atrocious. What was even more eye-opening, and it leads to the last comment too, was out of hundreds of school nurses that we were talking to, there was one, and this is a politically charged issue, we know, that came up and made it very clear. She did not appreciate the fact that in Barb Sattler's piece of her talk, she pretty much called to action nurses. They're building a whole cadre of nurses around fracking and saying that this is a public health issue. We need, as nurses, as a health community, to be advocates. She thought it was completely out of line, it was not appropriate, it was not her position. So she was an individual citizen. I'd like to believe she was the minority, but I just call the question, who do you all believe are the best messengers for the precautionary principle at this stage, while many of us continue to break down the political mess that surrounds these issues?
I think the children.
I've seen that in West Virginia where, again, people want these jobs. They think it's great. They're driving these chemical trucks because West Virginia's the second richest state in the union for natural resources, but it's like 49th on the list for quality, health, and poverty levels. It's a mess. And like I said, I'm not from West Virginia, but I moved there, and this is affecting me, so I'm certainly going to advocate. But that's the big thing, the children. That one community in Central Station, when their kids started having nosebleeds. And, the one gal tells me, I take my kids to the pediatrician, they get rashes all the time, they come and go. That's a systemic response to the toxins that they're breathing or drinking in the water. And they said the pediatrician doesn't know what to test for. And one of the things, again, we're not scientists with host farms, we just help scientists get the access they need. But if we can get doctors in West Virginia to be aware that they can come talk to these communities and let them know that some of these symptoms, not to put ideas in their head, but could very well likely be from the, exposure to the chemicals from fracking.
Thank you.
Just wanted to also point out, we talked about Texas, that Denton, Texas has passed a ban, and there's some other towns in Texas, and I think that's largely been inspired by effects for children and families.
When it hits your kids, you get active.
Hi, Rebecca. So my name is Mike Ewall with Energy Justice Network, and I wanted to put a couple invitations out there. We've been working on fighting the natural gas industry since before fracking was a thing, so from about past 15 years with fighting natural gas power plants starting in Pennsylvania. And I just wanted to invite, because I see a number of students in the audience, we have an Energy Justice Summer Program where in around Dimmock, Pennsylvania, where that really horrible spill was, and some of the worst fracking concentration in the country, we have a house called Energy Justice Summer, where folks are living and working together to support frontline communities in their struggles against fracking and related infrastructure there. So we're taking applications for that. If anyone wants to possibly apply for that program, that's out there. And closer to home, I've been working, or just starting to work with folks in Brandywine, Maryland, which is in this county. We have existing power plants. It's an environmental justice community. It's about half black. And there are about 2 existing power plants and about 2 to 3 proposed in the same community, pretty much all natural gas. So it's going to drive the demand for everything we're talking about. And this is right here in this county. And so we really need to prioritize putting resources into helping stop that, because natural gas power plants are now the largest source of demand and have been for several years now for natural gas. So talk to me if you want to get involved in that. Thanks.
Is there a way that we can have all these names for networking? Because there's a lot of...
I organized 3 sessions, and this is the first. I guess I better get an answer to this question. This is such rich information. We should, maybe by after lunch sometime, I'll have had a chance to talk to Jacoby and find out how the data is being shared.
And Rebecca, I'm circulating a sheet right here. If you're not already involved in the fracking movement in the state, or you want to oppose Coke Point, whatever, there's a yellow sheet passing around. Just again, leave your contact information and we can stay in touch with you, or trade business cards, whatever. Let us know how we can stay in touch with you.
Yeah, I'm seeing a lot of grim faces in the audience, but one of the things that I would say on the positive side of this is that people are getting, thank you, we got the time, people are really getting active all over the country because of this industry. So, and communities are coming together, people are getting to know their neighbors in ways they never did. Go ahead, I guess we have time for very quick 2 more questions.
So thank you. My name is Mike Beckham. I'm a Capital City Fellow with the District Department of the Environment. I'm wondering about remote sensing and air monitoring. I've heard it mentioned that we need to better monitor periodic, episodic exposure events. I've also heard it mentioned that there's new low-cost air monitoring equipment. How can we leverage the air monitoring remote sensing equipment, and then also with the new broadband mobile broadband networks that are being developed nationwide, can we leverage these resources with the monitoring and then this high bandwidth capability to get the message out about these exposure events?
Very quickly, Southwest Pennsylvania has 30, or I guess it's 100 monitors that we give to people for a period of a month or 2. They don't usually give them back, but anyway. And the University of London is doing a study in Montrose, Pennsylvania, where they're doing exactly what you're talking about, remote sensing, and the data is immediately going onto their website. So that's possible. The problem is figuring out what to monitor and then how to find when the peaks are going to occur. The basic problem, a major problem with the peaks are that they blow down their system about 30 times a year. And those peaks are beyond anything that you could possibly imagine.
Something I'll mention you might want to consider doing. Contact Michael McCauley at WVU, and I can get you the information, just pick up one of my cards. But I've worked with him a little bit before about the idea. He has a portable remote, I guess it uses the telemetry. It's exactly what you're talking about, where, like, for example, I'd love to be able to put it in different places where we're being severely impacted in West Virginia. And I think it's maybe about a $25,000 package for this, where they could set the air monitor, and it, like you say, it uses broadband to send it, and it's real time. And that's one of the things he was doing, is piloting that system that he developed to do that. Again, it's a funding thing, I'm sure but if there's an organization that can fund those to be placed strategically where they need to be, I'm sure he'd be willing to hear from you.
We are a
And
couple
al-
minutes.
Also, I just want to make one quick comment, and that is, I mean, you really need to know what is it that you are trying to go after, because there are so many different monitors, like most of the common ones are, like designed to measure particles and volatile organics, and these are real-time monitors that is, very good at capturing the peak, but for example, the VOC monitor does not tell you what individual chemicals are present there. So if you want information on that, like if this is a benzene, this is a butadiene, you have to use different set of monitors. And my lab is set up to do that. So we are putting together a research program, where we will be looking into this issue and working with the community and citizen science. That approach was used in this article that Anne just pointed out. So I think there will be opportunity for collaboration into the future. So I'll be happy to talk to you.
Yeah, thank
So
you.
we're a couple of minutes over. I think we're all willing to stay and take one more question. I want to quickly announce that on December 8th in Baltimore City and in Garrett County will be the last meeting of the Marcellus Shale Advisory Commission for the state of Maryland. And also, we have made a request to Dr. Wilson that there be a place on the website where we can put all of these presentations and contact information. So hopefully we'll be able to get that in the next couple of days. We'll pull that all together. One more question?
Briefly, David Reed with Jacob Stotsky. This might be directed towards Mr. Brown. I know Act 13 in Pennsylvania had a medical professional gag rule where it would expose any medical professionals to liability if they, I guess, linked certain constituents of the frack industry with a particular illness. I wonder if that affected your studies, or Mr. Sapkota, if it affected either of your studies or your research.
Well, we're not doing research. It did affect studies because people wouldn't work. A physician doesn't want to know the information if they can get sued. That was struck down by the state Supreme Court. It wasn't?
That part of the law was not strict, no. It was the ordinance part, right? It was unconstitutional.
But we do find that it's a problem. The big problem that we're getting are non-disclosure agreements, which block our information.
And we haven't really done the health study to, look at that specific issue.
Okay, so we'll stay for a few minutes up here and thank you all. Time for lunch.
Well, excuse me,